Hello, a
Hello,
very good afternoon, Dr. Vikas. How are you?
I'm good. How are you, Dr. Jasmine? Good afternoon.
All good. Good afternoon. Love from Delhi to Chandigarh.
Yeah, nice to see you
Doctor,
again.
please,
I think first
thank you
time we
so
are talking,
much.
we are just chatting now.
Yeah, right. It's the first live and it's the first interaction online.
Yes,
Yes.
yes.
So, Doctor, can you please just introduce us yourself a little, like your college of BDS and which year you took admission in BDS? Just the basic, so that we
Yeah,
all know.
okay. Yes, I have done my graduation from GDC Amritsar and from
Okay.
2003 to 2008. Then I joined in PGI as a house surgeon. We called it as a non-academic JRC. And it was
Right.
for 1 year. And then I cracked all India exam and I done my post graduation in prosthetics, obviously, from 2010 or 11 to 13, 3 years from
Okay.
GDC Bangalore. GDC
Okay.
Bangalore. Then coming after done like post graduation, I cleared a senior residency exam, FSHP exam in PGA. Then joined in PGA in 2014 to 16. So
Okay.
from 2016 onward, like I'm in private practice till now.
Okay, great. So, doctor, you are an MDS in oral surgeon or prostho?
Prosto. I'm a prosthodontist.
Prostho, right, right,
Yes.
right, right, right. Got it. So, I can't wait to, discuss a lot that we have been seeing through your reels. So,
Yes.
sir, firstly, how come a dentist doing eye prosthesis? I'm quite aware head and neck is our region, but still, it's not so common. A dental surgeon just go, people question that
Yes.
if he or she is even a doctor, wo eye prosthesis kar rahe hai, and so good that you can't even, actually make out if which eye is a prosthetic one and which one is a real one. So, how come a dentist is doing that?
Yeah. Very nice question. Actually, a lot of say dentists, not only dentists, even that ophthalmologist ask me. Uh,
Yeah.
when I'm like doing a prosthesis case, then obviously the other eye is fine. The patient go to for regular checkup, and when the ophthalmologist they see that eye, then they ask who has made this. Then they usually tell me that this is the dentist, like they have made it. Then many times they call back also, how you are doing that, how you have learned that thing. So and it's not like it's not in our curriculum or it's not in our study. In prosthodontics also, we have a like we usually call it as FPD, RPD, and CD. There's also
Okay.
maxillofacial prosthetic separate book we read for that. So
Okay.
so it's not like not a part of our study, but only thing we never give focus too much on that thing. So that's why we are not doing also. And how
Right.
I have started it is like we say as a law of attraction only. In when I joined in 2009 to 10 in PGI, we were like normal cases, disinfection, root canal, we're doing that thing. We have a posting on rotation basis. So when our posting changed to prosthetic department, so most common cases were observables. So sometimes
Right.
nowadays mucormycosis is very common, but in
Yeah.
2009 or 10 it was not that common. But cases were there.
Right.
So there was one case where that eye loss was there and obviously maxillary defect was there. So that HOD and PGI they were like planning and discussing that case. So when I saw that case, I was like, wow, this is very difficult case and different case compared to that what we usually are doing. So at that time, I will say small seed coming to me like I have to see these things, I have to work on it. But obviously, at the graduation level, we can't even think about what branch I'm going to join. I'm not that type of like
100%.
I have to do this branch only. I just preparing for my MDS and definitely if anyone asks me what branch you prefer, I'll say prosto. And then obviously exam happened and I got a thank God I got like prosthetics only and in GDC Bangalore. And even I went there, we become like in normal schedule doing PG work, MDS preparations or other clinical work. And after 1 year, I got to know like senior told me there's a few maxillofacial cases are going. Again, I thought thank you. I mean something is really which I want. It's already it's there. So, but cases are very few. I think in most of cases there's some quota in MDS also for 1 or 2 maxillofacial cases they are doing. Similarly, there was also quota, and so we were doing that eye prosthesis cases only. And at that time, senior helped me, my HOD helped me, and ophthalmologist was there in there's a Minto hospital near to GDC Bangalore, and also they have helped me. And some oculist also they have helped me a lot. And after that, we have done I think 5 to 6 cases there during my MDS. Then I
Okay.
joined in a PGI as a senior resident, and then the journey like changed a lot. When we were one case came, the patient has an accidental history and he has lost his front teeth, and he has also lost his one eye. So patient came to me for teeth replacement.
Okay.
So we were planning, but there was like loss of an eye also. Then I told him we can do that also. Even my HOD, my that other colleague, they said like how we can do that. This is like not our thing. So, but there we have started, and in PJ also I have done more than 300, 400 cases, and now with the board grace we have done more than 1,000 cases of eye
Oh,
prosthesis.
wow. Sir, so like I was in conversation with the Indian dentist who is the first in equine dentistry, the horse dentistry. So she mentioned that the vet doctors and the equine dentist have some, keep on having some guidelines issue or protocols issue. So does dentist doing the eye processes interfere with the eye doctors thing? Is that a thing, or we can do what you are doing actually?
Yeah, we can do that. See, definitely we should have a basic knowledge regarding
Yeah.
as a socket also. It's not like eye is
Right.
there or something. It's basically empty socket there after the eye
Exactly.
removal, and
Exactly.
that is the inner surface is similar like mucosa, except in few cases where we called it as a term phthisis bulbi, where the eye is there but it is shrunken.
Okay.
And
Got it.
most of the work which in eye processes we are doing, that's not like typical any ophthalmologist work. It's most of the like dentist work only. Impression
Right.
taking,
Got it.
giving shaping, and that
Yeah.
artistic
The
method. It's I will not say
carving,
it's
the yes.
yes. And in foreign countries also a lot of prosthodontists, they have a big center of maxillofacial
Wow.
prosthetics. Extraoral
Right.
prosthesis, they call it as extraoral prosthesis. Something we have
Right.
in prosthetics, intraoral and extraoral. So most
Yeah.
of us give focus on intraoral bridges, crowns, dentures, implants, but this is extraoral. Either it can be, we can say ear, nose, eye, and yeah, yes.
Okay, got it, sir. So, sir, so Prosto can do it, or any other MDS can do it as well, or a BDS. But if we have the right experience, skills, and the knowledge, I guess we can move forward with that.
Yes, yes. I will not say. See, in dentistry, there is not any clear, we can say, walls in between the branches. Even
Yeah.
periodontist is putting implants. Obviously, the
Yeah.
implants are periodontal. On pedodontists are putting implants, and oral surgeon they are doing RCTs. Even I mean, I'm doing root canals and everything. So I think
Okay.
it's bounded to like prosthodontists. Anyone who has interest and skills also they can. Nothing
Wow.
any
Okay,
bounded.
sir. So, wow. So usually I have seen like orthodontists are not doing RCTs, but you just mentioned you do RCTs and dentures and everything. So
Yes.
I'm glad.
Yes, maybe,
Okay.
nowadays I I think until unless you're very much particularly I want to do that thing. Otherwise, in practice you need to know everything. You have to
Yeah.
do. Well, basic knowledge is there. If there's a complicated case, definitely that specialized person should be there.
Sir, so I just posted one short video on YouTube, and it was in a dentist was giving IV. Like in the clinic, we were giving IV to a patient because at that time the nurse we had was not so confident. So,
Mhm.
people were questioning, like, you are not doctors, how can you give IV? No matter how much you call yourself doctors, you will never be a doctor, you are just dentists. So, this conversation is different. So many people don't know, even we as a dentist did not know the depth of dentistry right now.
See, this question, I say, this is not. Uh, Both the things they will everyone has some reasons to fight. We should know,
Yeah,
we are aware of that. That's it. I think, whether it is
right.
a comments or in a someone is saying something, you should not take it seriously.
Right.
It's part of that thing. When you are doing something new,
Exactly.
obviously someone say why you are doing this. It's
Right.
it is part
Sir,
and parcel of it. Yes.
right. So, sir, how different is your setup from a dental clinic setup? Is it the same or some things are different?
Uh, I'll say 80% setup is same, but definitely a separate space for that the prosthetic parts, and we doesn't require much of use of dental chair. So
Okay.
that separate area, definitely some equipments are there, and some materials are there. It is there, and I will not say it require a big space and big, but definitely few things are there. Like we are doing whatever the cases you have seen that are related to acrylic, I'll say acrylic prosthesis. But few cases we have to use silicone also. And when there
Yeah.
is silicone and then completely different materials, completely different protocols, and that are used, and it is more time taking compared to the acrylic part. So different setup, but not 80% of the my clinic part is similar than like the regular.
Okay. Sir, just a different question, but related to this part is mistakes that we should avoid while we are opening the clinic. From your experience, can you share? Because nowadays every road has at least 10 dentists. So there are various factors that involve while opening a clinic, but few mistakes that you would definitely share with us that you should surely avoid them according to your experience.
But I mean, there's a two type of question I can say. In term of you are saying patient's footfall, or second is during working the ease of working you are saying. I mean, when you
Sir, patient
say
footfall.
patient footfall, it is a complicated question, but I will say,
Yeah.
see, it is not. Uh, it depends upon your specialty, the type of work you want. See, if you are typically working for aligners, let it be, like if you are working for aligners, then definitely you want to open in a very, very good area. Because
Yeah.
if you will open in a low socioeconomic area, then obviously that aligner part will not be justified there for the patient. If you are
Right.
implantologist, you are doing implants similar way. But if you are more like work, you want to work simple uh, dentistry like restoration, root canals, capping. I think then, I mean, you can open anywhere if you like the payments, everything. You have to see rents also, the place
Right.
also, and footfall by marketing. You can increase it initially to retain the patient, to get a new patient. That initial patient need to be satisfied. It doesn't
Yeah.
depend
Our
on
work.
yes. And the main marketing tool, I will say, is the word of mouth till date, and it will remain
Right.
on.
Right.
Whatever the
Right.
social media will be there till the time, like patient say someone to the relative, I am satisfied. The patient, the next patient will come. He will or she will just sit on the chair and open the mouth. Looks up, kar do. Okay, na? They
Yeah.
will not ask
Right.
much questions.
Right. Right. Sir, so I can't wait to understand what are the steps involved in eye prosthesis. Suppose a patient comes and he doesn't has one eye. Now what, how and what will we proceed?
Yeah. So basically, uh, that type of patient, first thing is we are getting that eye prosthesis patient of different history. Few patients have some accidental history due to some trauma or due to some accident, even that Diwali cracker injury. And I mean,
Okay.
this type of injury, accidental injury, either it's a roadside accident or through fight also. The other part is by congenital by birth. Some patient doesn't have eye, and third category I say it's like a malignant tumor or some cancer in the eye, which is in dentistry we read about retinoblastoma, most common tumor in the eye in the kids. That are also patients are there in kids retinoblastoma, and some are infection. So these are the 4 5 categories from which the patient come in. Then you have to ask the history also how what happened, and you have to inspect that area. Then we proceed with the first step is impression taking, that impression of that area. Then we give the shaping so that both the eyes look open, of equal height, equal width, and then we do acrylization of that thing, and then we do the coloring part of that, and after coloring we then finally again acrylation to give a like polishing layer, transparent layer, then deliver that. So it's a four-step process, I would say: impression taking, carving, then coloring, then delivery.
Sir,
So
how
this is a
long does it take from step 1 to deliver?
good question. When I was started, I usually take 3 days. Now I can finish in 1 day, 2 days
Oh,
can finish. Yes.
okay. And sir, like we have dental labs associated with us, so which lab this all goes to? Is there a lab
No,
involved also
no,
here?
no, no, no. Everything
Okay,
is doing at the clinic. No, because lab persons, they will not
okay.
aware of that thing. Either you
Right,
teach them, or
right.
it's better to teach. I mean, your assistant only how
Exactly,
to. So I'm
exactly.
not
That's
like
better.
attached with any lab or this.
Okay. And sir, out of curiosity, I want to ask what impression material, like for alginate silicon, we have putty here for the dental. What is like used for the impressions of the eye?
It mean either mean in few cases depending upon that socket defect, alginate can be used and light body can be used. Not putty, alginate and light body. I mean then depends upon the
Okay,
defect area. Yeah, either alginate and the light
okay.
body. See, I mean it's not limited to that eye thing. We are doing cases ear prosthesis also, nose prosthesis also, even finger prosthesis also, toe prosthesis also, and facial defect prosthesis. And all area has a different soft tissue profile, and depend upon that compressibility or soft tissue profile, you can choose the impression material. And if like we are using I'll say orbital defect. There's a big defect. There is a loss of eyelids also. Like in mucor black fungus, we put it. There's a big defect on the face. In that case, I will not recommend to use light body. Rather than alginate will go for a nice impression. But if there is
Right.
a very precise some ear prosthesis, like a patient has a small ear, very small, like absence of ear, I'll say from the birth. In that cases, I will prefer to use light body for that, because some curvatures of the remaining ear is there that we want to, while removing that impression, that should be nicely recorded. So light body has a good shape memory compared to alginate, so I will prefer that.
Right. Got it. Sir, so what do you think is the future of maxillofacial or extraoral prosthesis in India?
Uh, See, typical having like a prosthodontist, we are knowing everything is changing very quickly. In like in 2000 to 2010, whatever changes in 2010 to 20, now in every 2 to 3 years, completely there's a different scenario. I'll give you example of like a impression only. Before that, everyone like 15, 20 years back, alginate is the main thing. Then putty, light body came. Now for every impression, like prefer light body and putty we are preferring. And nowadays digital impression came. So we are moving
Yeah.
digitally. And even there's no need to like pour it and send to the lab. Directly you scan it and send to the lab, they will send you the crown. Similarly, even in maxillofacial prosthesis, the way we are currently using, it's similar impression taking, then like making a dye, we can say that, then curing it, then processing it. But in future, that currently that scanning part in maxillofacial prosthesis, I not say it's very up to date, but dental part it's very good.
Hmm.
And for maxillofacial, there must be definitely updates regarding that. So in maxillofacial prosthetics, that scanning part will add on the ease in the practice also. Then obviously after that in computer you can work for the shaping of the, like I'll say patient has missing 1 ear.
Hmm.
We will scan that area of missing ear, and we will scan the that other 1 ear also, and
Right.
then we will simulate that ear in the negative replica over that ear, and
Okay.
that we will get the image whatever the missing part is there, then that we can mill it in a milling machine.
Right.
After the
Right.
milling happen, then that obviously currently I will not say there is a technique. We will say that machine only will do the color matching and everything and give you the final process. That milled part will act as a I will say trial or wax trial or acrylic trial. Through that we can make a mold and in mold we can fill it with the silicone with the color match. So that final
Yeah, got it.
part will come the color match with the silicone thing. Because even the
Right,
CAD cam, we can't put silicone there for the milling. Either we
right,
have to put acrylic for the milling or the ceramics. So obviously acrylic milling, then mold flasking for that, and then silicone packing. So that is a future,
right.
and definitely it will ease the work also. And in England also recently, around 3 4 months back, they have made first artificial eye, which is completely machine made. They have
Okay.
like CAD cam milled eye, but definitely that outcome is not that satisfactory compared to the handmade. Even in any
Right,
country, but
right,
handmade is still the best one. But they have achieved something complete milling with a computerized.
right. So, so in general, what do you think the future of dentistry in India?
It's
Because many BDS, many fresh pass outs after 12th are very worried to enter into dentistry.
see, you take the name of any other field which is very have a good amount of jobs and which is very, you say, very satisfying
Exactly,
industry. I do not think so.
exactly.
I mean, there's my friends are who are in like doing MBA also, and if you are engineers, if you are in banking sector, everywhere it's there. You have to be
Right,
the champion in your field. No one can stop
right.
you. I'll say, even like I was in MBS teaching also around 8 year, 10 year. I
Okay.
like taught many students there. So
Oh,
obviously, during the graduation period and in final year internship, there's a big dip to the students. What will happen to us? I mean,
right.
after internship, what will do that? Rather than then few students take around 1 year to think about what I want to do, and
Yeah,
they take a lot of time, and then time like they take it takes them to more confusion only. They get more confused only. So
right, right,
like initially they thought we'll go to abroad. Then after 2 months they call someone. They say it's very difficult here. Then okay, we'll stay. We'll prepare for MDS. Then 2 months they'll start for the preparation of MDS. Then after 2 3 months of coaching, then they say no, there's a lot of competition. My professor only that who is in the college, he told me it's not worth. So again they will come back and say I want to plan open a clinic only. Then they meet someone. They say clinic opening is not that easy. Patients are not coming. How you survive? Then they try to change the line. Then again, see, it's not about choosing better thing. It everything is good. Only you have to master in it. So even few clinics are working like very nice. You see in your area also there's a old dentist who are working very nicely. Even a new dentist came from AIMS also, PGI also. He has to pass through that competition also. Right? No that
right.
whatever
Correct.
degree you have from which place, the patient doesn't know that thing.
Exactly.
You have to satisfy the patient. You have to make the good
Correct.
treatment, good relation with the patient. Then only the patient will come.
Right.
So
Sir, we have a
future,
question from.
yeah,
Yes,
yeah.
please.
Please.
Sir, is there any solution for tosses eyelid drop patient without surgery?
Yeah, it's called as crutch glasses. Crutch glasses.
Okay.
Okay, so basically there is a spectacles over that. Usually this is a frameless, but with frame.
Right.
There is some extension attached on the upper side, which cause that upper eyelid lift, keep it lifted. No doubt it's not. I'll say comfortable, much comfortable for the patient, but it is very useful for those patients who, due to any reason, surgery cannot be done. And
Right.
otherwise, this is a very good. Few patients we have given correct glasses, they are very happy. And few patients, obviously, there is some pressure is there continuously. We can't like close the eye, but they have to lift the specs and close it. Then again, they have to place it to
Right.
lift that eye. So we'll call it as a
Yeah.
crutch glasses. Crutch glasses.
Okay, got it. So, sir, thank you so much. It has been an insightful session, and I'm really grateful.
Same here, same. Thank you very much.
Thank
Thank
you
you very
so
much.
much.
Thank you all.
Wish you all the very best, and I will be staying in contact with you for all my doubts.
Okay, no problem. Most welcome.
Thank you, sir. Thank you.
Okay,
Please take
thank
care.
you.
Bye.
Bye.